Hi, I'm Jack. I'm an advanced dietitian in Australia and a professor of nutrition at the University of Iceland. So, what can be done to improve the number of people who receive simpler actions? Changes can target increasing the capability of health workers, patients, and carers through better knowledge, skills, and understanding. It is also important to create opportunities to make the right thing easier to do. Finally, it is important to consider improvements that motivate people to do the right thing. Over the next few slides, we will give examples of lots of different improvement ideas. Some of these will be very helpful in your setting. Others might never actually work. Don't try and do all of them. Actually, we suggest just selecting and testing one change that might lead to improvement. Then work with your local team and patients to see if it leads to an improvement. If it does, then keep doing it. If it doesn't, make a change or try something different. This approach is supported by the Model for Improvement and the COM-B. If you want to know more about these, links are available in the references of this unit. So, what can help improve the proportion of patients who are at risk of malnutrition or already malnourished who receive high protein foods and fluids? Firstly, it can be very helpful to develop the knowledge and skills and understanding of staff. Doctors, nurses, physiotherapists, assistants, and lots of other members of the treating team should know why protein-rich foods and drinks support recovery. For example, helping to rebuild muscle, aid healing, and improve mobility and function. Of course, the dietitians know how to do that, but there's not just enough dietitians in the world to see everybody who needs to get this information. It is also important to make sure staff know where and how to access high-protein foods and fluids for those who might need them. This might be simply pointing out menu items or pantry locations, or how to order high-protein diets in the information systems. It might also be helpful to make sure staff know that it is actually okay to suggest family and friends can bring in a favourite high-protein food or drink, as long as that's okay in your system, of course. In many settings, nurses, doctors and assistants and others are supported to estimate and document intake of protein food and drinks. This helps identify low intake early. Teach staff to identify and manage common problems that stop people from eating and drinking, such as pain, nausea, or chewing issues. I particularly like using real patient stories that highlight the difference having high quality, high protein, and fluid choices makes. These stories help everyone understand the benefits. If your food service system or your catering system in your hospital isn't as good as it could be to deliver good clinical care, take steps to increase the understanding of funders and executives about how improving food service and catering systems can improve patient and healthcare outcomes and reduce wastage. You can see on your screen a recent article as an example, which is also available in the references of this unit. It is also important to consider just how to improve the knowledge and understanding of patients and their carers. Consider providing basic training and resources so that different members of the team can all explain to patients what high-protein foods and fluids are and how they support recovery. Encourage patients to set simple intake goals, such as having protein serves at each meal and between meals, and help them track what they've eaten. This helps boost their confidence and engagement in care. Also take the time to align nutrition intake goals with patient-centered goals, like, for example, being able to return to gardening. And support patients emotionally, especially after surgery. A kind word or reassurance before meals can motivate them to eat better. To help more people receive high-protein foods and drinks, it is important to make the most of opportunities to make changes to the physical and social environments. Consider making high-protein foods and fluids part of routine care for all hip fracture patients and others at risk. Design policies, pathways, systems, and workflows so that it's the default. No special requests are needed. Supporting access to high-protein foods and fluids is really important. Make sure that high-protein options are available at every meal, between meals, and even after hours. Be sure textures are suitable for patients with specific needs. And also make sure that high-protein choices are available and appropriate for people with different cultural preferences. Use visual reminders, whether it's red trays, electronic flags, or handover notes, to prompt staff to prioritise nutrition in daily care. Respect meal times. Align meals with patient routines and avoid unnecessary interruptions. This simple step can help improve intake. Some patients need extra support. Make sure staff and volunteers have time to assist and encourage patients at mealtimes. Many older people who are at risk of malnutrition or are already malnourished follow restrictive diets that are not necessary. These can even be harmful. Doctors may wish to build in processes to help deprescribe unnecessary dietary restrictions during their routine ward rounds. Using visual reminders, like red trays, like I said before, can be helpful, especially when combined with other improvement processes. It's no use having a red tray if people don't know what they're for, or just relying on that by itself. But together these things can help prompt staff to prioritise nutrition in daily care. Making changes to the ward environment, like a ward pantry or mini kitchen stocked with high-protein choices, can make a really big difference. These adjustments remove barriers and make good nutrition care much easier for all. Finally, teams should check to see if care standards and guidelines recommend providing high-quality, high-protein foods and fluid choices for all patients with malnutrition or who are at risk of malnutrition. And if they're not included in the care standards or guidelines in your nation or country, then think about what might be done to change that. Motivating people is also very important. To help improve received high-protein foods and fluids, which is one of the simplest 6 actions, it's important to motivate people to care and act. Work with patients and the team to set clear, measurable goals, ones that can be audited easily. Sharing real patient stories about better outcomes from good nutrition can definitely help build understanding and emotional connection. Making food enjoyable really does matter as well. Offering familiar, high-protein options can increase intake. You can encourage staff and volunteers to sit with patients at meals. It makes them feel supported and more likely to eat. Leadership matters as well. Appointing a nutrition assistant or local champion helps keep efforts visible. Showing how intake tracking improves nutrition can help staff see the value of their work. And even small rewards or awards can boost motivation. And when executives support better food service systems, it shows that nutrition is a priority for everybody. To help more hip fracture patients and others at risk get the high protein foods and drinks they need, the whole clinical team can make a difference. It's not just about offering food, it's about making sure people get the food, eat and drink it, and that we check if it's enough. Nurses are really well placed to be responsible for ordering high protein foods and fluids. They're usually the first to notice if someone isn't eating or drinking well. They can help patients during their meals, check that the right food and fluids are served, and record how much was eaten. Nurses can also speak up when something needs to change. Doctors can support the team by making sure food and fluid needs are included in the care plan. They help avoid long fasting times and make sure that high-protein diets can be started again soon after surgery. They can remind the team why nutrition is important for healing and play a bigger role by advocating for better food service systems, such as improving food quality and making high protein options available as a standard part of care, not as an afterthought. When doctors speak up, it can help bring policy, funding, and leadership attention to nutrition as a clinical tool. Allied health professionals like dietitians, speech pathologists, and occupational therapists can really step up to support high protein nutrition. They can check that the right food and fluids have been received, help patients eat and drink safely, and work with staff and families to motivate and support patients. They can help and train other staff, troubleshoot barriers, and make sure eating and drinking is part of the patient's recovery plan. Healthcare assistants are also very important during mealtimes. They can help patients sit up, open containers, encourage intake, and assist with feeding if needed. They often see things first and can tell the team when something's not right. There's also students and trainees. While they're still learning, they can observe and monitor intake, ask questions, provide encouragement, and help out at mealtimes. Volunteers, when trained, can also make a big difference. Just by sitting with someone during a meal, encouraging them to eat, or letting staff know if something's wrong, they can help make care more personal and more effective. By now, you've probably seen a version of this in earlier units, so we won't go through every group again, but it's a good reminder that making sure patients receiving high protein foods and fluids isn't just a job of the clinical team. Systems and support teams such as food service administration, information technology and support, executives, educators, quality teams, these all play a big part in making sure high protein options are available, easy to order, and supported by systems and training. Advocates and influencers, including patients, carers, professional organisations, and researchers, can raise awareness, share real-life experiences, and push for better access to high-protein food and drink options in hospitals. The takeaway is this: it takes a whole system working together to make high-protein food and fluids the standard for all hip fracture patients. We can't just rely on the dietitians. It also ensures that anyone who is at risk of malnutrition or is already malnourished receives them too. There are many times and places where we can help patients get high-protein foods and fluids. It can start early, when a hip fracture is first found, or when a patient is screened and shows a risk of malnutrition. In the emergency department or when someone is admitted to the ward, we can make sure nutrition is part of the plan straight away. During meal ordering or menu checks, we can make sure high-protein options are offered and are available. Sometimes our electronic systems like the electronic medical records will send us reminders or prompts. These are good chances to act. At the bedside, during handovers, team rounds, and even especially during physiotherapy sessions and mobility sessions, we can check if patients are eating and drinking enough and if they need assistance, or even if they need a supplement. We can talk about nutrition during patient education, discharge planning, or follow-up. Nutrition should also be part of training for staff, students, and volunteers. Simulation and skills sessions can definitely help us practice what to do. Audits, dashboards, and quality reviews are another way we can look at how we're doing and what we can improve. And of course, changes happen through models of care, pathways, policies, and care standards, and when leaders discuss funding and strategy. No matter where you work and no matter what you do, there are lots of moments where we can take action. We just need to notice them and make the most of them. Don't make it complicated. Keep it simpler for better nutrition and better outcomes. I'd like to now invite you to watch this short 3-minute animation. It shows the different simpler improvements can make. Mr. E's journey shows you how early nutrition care can really help. Even if you've seen this video in another unit, it might be worth watching it again here. It will help to look for things that you've learnt in this unit in particular. After you've watched the video, we will then invite you to take some time to reflect on what you might be able to do to improve things in your setting. So it's time to reflect again. What are 2 or 3 realistic changes you think could improve the proportion of hip fracture patients, or their carers where appropriate, who are offered and consume high protein foods and fluids in your setting? These could be changes that influence capability, opportunity, or motivation. Also think about who could be involved, when and where the change could happen, and why the change is important. Just put in a few of your thoughts. This is not assessed, it's just to get you thinking. Once you've finished your reflection, you will find some useful additional resources. And after that, please make sure you complete the short quiz to check what you've learnt in this unit and to give us feedback about the unit.